Good morning, everyone. Today I want to provide a brief update on where we are and what we're looking at this week. As we covered on Friday, thanks to the hard work of Vermonters, and even as we slowly restarted the economy over the last 4 weeks, we continue to move in the right direction. Our data shows that we can continue to move forward, methodically putting more back to work and easing restrictions. Over the last 4 weeks, with health and safety protections and some limitations, we've been able to open retail, outdoor services, recreation, manufacturing, and construction, as well as campgrounds and lodging at 25% capacity for in-state guests. And Vermonters can now safely visit with family and friends for get-togethers of 10 or less. Now, we still have a long way to go, but we know what trends and metrics to watch, and if things continue as they have, then we'll be able to more and more open up while keeping people safe. But at the same time, we know the virus isn't going to disappear. Outbreaks are going to be a concern in the months ahead, so we must pay attention to the health guidance, because everything we've done has helped suppress this virus. And if we stay vigilant, we can continue down this road to recovery. It's literally in our hands. Every day, I keep a daily log of what's going on in other states around us. In Vermont, our case growth is minimal. In fact, last week we had only 15 new cases. And this is while we've increased our daily testing, which is really great news for Vermont. But right across the border in New Hampshire, they've added 400. And in Massachusetts, they went from 76,743 cases to 83,421 in 1 week. That's 6,678 more in that period alone. And in New York, it's about 14,500. So we know we can't only look at Vermont numbers, which is why I feel it's necessary to move a little more cautiously than just our numbers would suggest. And I know this is causing frustration for some, but remember, this virus knows no borders. It's also why I've directed my team to show you some detailed regional data and modeling as well, so we'll do some of that on Friday. The good news is, it's looking like we can continue turning the spigot this week. As I said on Friday, if things go well, we'll announce some additional openings, like hair salons and barbershops, limited outdoor seating at restaurants, and hopefully more services in the healthcare field. As well, in a few minutes, I'll also ask Secretary Moore to give an update on our state parks. I know this has been incredibly difficult for everyone, and in some ways the restart process is even more challenging than the closings were. But your sacrifices and cooperation have made a huge difference, and my team is committed to helping our businesses and families recover from this once-in-a-century crisis. So on Wednesday, we'll also announce a major economic package which will provide relief, hope, and initiatives to get us moving towards recovery. I thank you all for what you've done over the last 2 months and your ongoing commitment to keeping everyone safe. It's because of your hard work and unity that I know we're going to get through this together. And with that, I'll turn it over to Dr. Levine for an update.
Good morning. Thought I'd start with just an update on our experience in Vermont with COVID. As you can see, 940 total cases, 815 estimated recovered, 54 deaths. I believe last week the additional death was just one. And last evening on the report, we had many hundreds of tests done, probably in excess of 700. We're sorting those out, but no new cases. This is the flattening of the curve. I think we should probably take the word starting out now. We're continuing to flatten the curve. We continue with minor oscillations at a very low level of new cases on a daily basis. And our percent positivity, how many of the tests that are performed turn out positive, continues to be in the very low digits, generally under 5%, sometimes closer to 1 to 3%. And this is the syndromic surveillance, the number of patients presenting with COVID symptoms to either emergency departments or urgent care centers in the gold, and numbers presenting with influenza symptoms in the blue. And as I think I pointed out last week, there is essentially no influenza being reported now. So if someone feels ill in the same way that they would feel if they had influenza, they should think about getting a COVID test. Second thing I want to do today, I get a lot of questions about the difference between isolation and quarantine, and what does this actually mean if it's you? So I just thought I'd give a couple quick definitions. So isolation means you've actually been identified as having COVID-19, sick with those symptoms, or tested positive for the test without any symptoms. Quarantine means you have no symptoms, but you may have been in close contact with someone who had COVID-19, or you're returning to Vermont from another location, out of state, or anything other than essential purposes. Whether you're identified as isolation, meaning with COVID, or quarantine, meaning at risk for COVID, the same principle holds. You stay at home. You don't go to work. If you're well enough to work, you can certainly do telework, but you stay at home. Don't go out to get exercise in large groups of people. Don't go out to buy your own groceries. Need those services provided to you. And obviously, if you're remaining in your own home and you have isolation, meaning you have COVID, you should be really in your own room with your own bathroom, apart from anyone else living in that structure. So that's the difference between isolation and quarantine. Last thing I want to do is talk about what happens when you let your guard down. We spend a lot of time at these press conferences and on our website generally talking about all of the things we need to do. Wash our hands all the time. Not be around other people if we feel sick in any way. Using good respiratory etiquette. Social distancing, which I like to call physical distancing. Masking. Are these things still important when we have such great data? Well, let me tell you about Clinton County, New York. This just came out yesterday. They've had a total of 46 people that they've been following, either with COVID or as contact tracing. Well, they almost doubled that number in one day over the weekend. There were 9 new cases of COVID reported and an additional 27 individuals identified as close contacts, all related to parties that occurred in the city of Plattsburgh during that time period. So when I hear the word party, it's hard for me to imagine wearing masks, being 6 feet apart, not being in a congregate setting with a small number of people, and this is what happened there. So they essentially doubled the number of people they're now following in that part of the state with just one instance. And we know how that can happen so easily. So I just put that out as something that we need to be aware of, because I know I've pointed out at previous press conferences the fact that some of these behaviors and these behavior changes that we've asked everyone to adapt to and to really become part of what they do every day they actually do need to continue, no matter how good the data begins to look. You've heard the governor tell us today about the data from the region. COVID hasn't disappeared, and it's not being wiped off the planet's surface. So we are going to try to keep everything going as well as it's going here in Vermont, even as we open the spigot little by little. But by the same token, it doesn't give us a pass to not do the things that really count when it comes to preventing transmission of virus from one person to another. Now, as promised, Secretary Moore.
Thank you, Dr. Levine. I'm here to provide an update on Vermont state parks. It's clear that Vermonters' interest in and appreciation for outdoor recreation opportunities in recent weeks has been nothing short of unprecedented. State parks, town forests, trailheads, fishing access areas, and bike paths are all being used by people seeking the emotional and physical health benefits of outdoor activity as we cope with the COVID-19 pandemic. And with Memorial Day weekend, replete with sunshine and temperatures forecast to approach 80 degrees, time spent outdoors in the days ahead is sure to help things feel a little more normal, maybe even be a little more normal. And an important part of summer in Vermont for many, myself included, is time spent in Vermont state parks. With 55 beautiful and inviting locations statewide, our parks will be an important asset and outlet, whether for day use or overnight accommodations, in satisfying our collective desire to get away. Even more so when our options for summer travel this year may be more limited. In late June last year, my family was packing for a road trip to the Outer Banks of North Carolina. And while traveling that far afield may not be in the cards this year, I'm still planning to be packing for a late June trip. This go round, it will be to Green River Reservoir State Park and Hyde Park for paddling and remote camping. State lands, our parks, forests, and wildlife management areas have remained open for visitation, though not staffed or fully operational, throughout the spring. And we know many Vermonters have enjoyed the woods and water of these places for weeks. Although we had to delay our traditional schedule of official openings this year, we are currently in the throes of preparing our parks for expanded summer use, including making necessary health and hygiene improvements to limit the potential spread of the coronavirus. Over the coming weeks, staff will be readying campsites and beaches, firing up drinking water and wastewater treatment systems, installing portalettes, and opening our contact stations. We are working hard to have as many of our parks fully operational as possible, as soon as possible, and encourage you to check our website, vtstateparks.com, regularly for the latest updates. I also want to be upfront. Things at our parks will likely look a little different this year. We will be taking steps to help promote and maintain physical distance between unrelated park visitors, between staff and visitors, and to manage, reduce, or eliminate common touch points. It will be critical that all of you, park visitors, become our partners in this endeavor by also committing to minimizing the risk to each other and park staff. Steps we will be asking all visitors to take include postponing your visit if you are ill or have recently been exposed to someone who has tested positive for COVID-19, maintaining at least 6 feet of physical distance from anyone you did not travel to the park with, wearing a cloth mask whenever you might encounter other visitors or staff, or generally anytime you're not swimming, exercising, or at your campsite, bringing a supply of hand sanitizer and sanitizing wipes and making good use of them throughout your visit, and coming prepared with a few extras. While state parks will continue to provide innumerable opportunities for swimming, picnicking, fishing, hiking, and camping, other services, such as loaning play equipment, camping and fishing gear, sales of merchandise, boat and bicycle rentals, and concession stands, are unlikely to be available this summer. Ice will be sold, but only at those campgrounds that do not have a local store nearby. For folks coming to our parks for day use, park capacity will be managed to ensure room for sufficient space. To ensure room for sufficient space is available for social distancing. This will be done on a park-by-park basis and generally by reducing the number of parking spots available. Please bring a water bottle with you. Although regular water spigots will still be available, water fountains have been disconnected. And toss a picnic blanket or folding chairs into your car when you head out to the park. as the majority of picnic tables, movable benches, and chairs have been removed from day use areas. Group gatherings and use of picnic shelters will only be allowed if consistent with the restrictions in place at that time. Currently, as you heard Dr. Levine say, gatherings need to be limited to 10 or fewer. And so if you've reserved a picnic shelter for an event this summer, you can expect to hear from park staff about the status as your date nears. And unfortunately, the swimming pool at Button Bay State Park will not operate this summer, as it would simply attract too many people to a small area. In terms of camping, we're in the process of onboarding the more than 300 seasonal staff that make our parks hum, and we anticipate camping facilities will be ready for overnight guests starting Friday, June 26th, if not a short while sooner. State park campgrounds will offer tent, RV, and lean-to camping. Existing reservations are being honored to the maximum extent possible, and new reservations can be made online, again, at vtstateparks.com. Cabin and cottage rentals will not be available this summer. Anyone with an existing cabin or cottage reservation can expect to hear from park staff regarding your options and alternatives. Campers should consider packing some additional items, things like hand sanitizer and a tablecloth for the picnic table at your site. Firewood will continue to be available for purchase at all campgrounds. Camping opportunities for out-of-state visitors will be limited to those that have self-quarantined according to the CDC and VDH guidelines in Vermont prior to entering the park. In addition to our 55 state parks, there are other innumerable special places to discover throughout Vermont. Our state has more than 750,000 acres of public lands and a network of trails that spans public and private lands, totaling some 5,000 miles. Vermont also has more than 800 lakes and ponds and more than 190 fishing access areas, providing places to launch your boat or kayak, as well as shore fishing opportunities. And so I hope you will seize the opportunity to play tourist here in Vermont. Instead of visiting a crowded waterfront park like Burlington's North Beach or Waterbury Center State Park, consider other places that don't see as much use. For example, check out one or more of Vermont's 99 wildlife management areas, where birding, boating, and hiking opportunities abound. I recently hiked the Moose Bog Trail at the Wenlock WMA, whose final section is a boardwalk and observation deck looking out over a simply beautiful wetland complex. For birding, wildlife watching, and other wildlife recreation activities, consider larger parcels of fish and wildlife lands, like Victory Bog in the Northeast Kingdom, or the newly expanded Birdseye WMA in Castleton, or the Windsor Grasslands WMA. And rather than heading to heavily trafficked trails at Mount Ascutney or Camel's Hump, instead spend a few minutes on the Trail Finder website, which is trailfinder.com, and find a new, less well-known adventure to try, or give the Green Mountain Club Visitor Center a call at 802-244-7037. For more ideas about how to explore all Vermont has to offer this summer, check out the Vermont Venture Challenge. And here's how that works. You start by downloading a worksheet from the state park's website. The worksheet contains a range of fun outdoor activities, everything from rolling down a grassy hill to building a fire and starting it using just one match, to finding the biggest tree in the Vermont State Park. And each activity is worth a certain number of points. To participate in the challenge, you need to take a photo of yourself completing the activity, and when you reach 250 points, submit your score sheet and photos to our parks program. Anyone who successfully completes the venture will receive a VIP coin, good for free state park day use for the rest of this year and all of next. Vermont is glorious because there is space to do and space to be. Whether or not you choose to participate in the Vermont Venture Challenge, outdoor recreation opportunities are plentiful, and I hope you will have a chance to get out and explore a bit more of what our state has to offer in the weeks and summer months ahead. Thank you.
We'll now open up to questions.
Calvin?
All right, so quick question there, Governor, for you, or maybe Secretary Moore. But so you say the 2-week quarantine rule still applies to visitors from out of state. They can't check into their campgrounds until they've quarantined for 2 weeks. How is that going to work if they don't have a place to quarantine?
Yeah, again, what we want to do is make sure that we're taking care of Vermonters first, those who have been in the state for a period of time. They may have, some of these residents may have places of their own, second homes here that they have quarantined in, or friends and family that they've quarantined with, and then be able to take advantage of that. But it's not a perfect system by any means, and maybe Secretary Moore if she has anything else to offer to that. No, okay. That's basically not a perfect system, but we're trying to accommodate as many people as possible. We're hoping that Vermonters will, again, have a staycation, explore Vermont. As Secretary Moore had said, many people have had planned vacations outside of the state. They might consider just staying right here at home.
And then quick sidebar question. I think this might be either for you or Commissioner Harrington if he's on the phone. We're hearing that large companies are asking workers who can't return to the job when they've requested to, we're hearing from large companies that are asking workers who can't return to the job when requested to resign. These are people that can't go back to work because they don't have access to child care. It's our understanding that the job protections from the Federal Families First Coronavirus Response Act doesn't apply to businesses with more than 500 employees. Can and will the state revise its expanded family leave policy to protect the jobs of employees at companies employing 500 people or more?
I will defer to Commissioner Harrington on that. It's not something that I was aware of. I didn't realize the 500 number. Obviously, we want to protect Vermonters and make sure that they have the child care necessary before they go back to work and protect their families. So, Commissioner Harrington?
Thank you, Governor. Could I just have the question repeated? It's just hard to hear.
Yeah.
Sure, sorry.
Could you try that again, Kyle?
Do you want me to read the whole thing one more time?
Calvin,
okay.
Sorry.
So we're hearing that large companies are asking workers who can't return to the job when requested to resign. These are individuals who can't go back to work because they don't have access to child care. It's our understanding that the job protections in the Federal Families First Coronavirus Response Act does not apply to businesses with more than 500 employees. Can and will the state revise its expanded family leave policy to protect the jobs of employees at companies that have 500 or more employees?
I believe I caught all of that. So I was not aware of that as well, so I'm happy to get back to you with more information. There are exceptions in the Family First coronavirus relief package, specifically around family medical leave. What I will say is that these people would remain eligible for benefits. And I also want to point out that we do have and posted, as we said, we are going to a FAQ on our website, frequently asked questions pertaining to employees and employers about what their rights and responsibilities are under the various relief packages that are out there. And there is a specific question on there. It's lengthy, the response, so I won't go into the whole detail. But if an employee is unable to return to work due to needing to stay home for care for a child, can an employee terminate that employee? So there are details around that as well as others. So I would just encourage people to go to labor.vermont.gov, and some of those answers may be already presented for people on the frequently asked questions.
We'll take a look at that further, Calvin. Yeah, the 500 limit rule.
Morning. Two quick ones. Governor, could you just clarify, some hair salon and barber folks are asking if you meant on Friday, and you repeated it this morning, that they can open June 1, or that you'll tell them on June 1 when they can open, or they might be open between now and
Yeah, it's going to be a little bit of both. We're still want to make sure that we're secure with the numbers, but if the numbers hold up, we're hoping that it will be almost immediate, but it really depends on the numbers this week. So I'll have more clarity on maybe Wednesday, because I know that they have to prepare, as do others that I've mentioned as well. So I'll try and provide a little bit more clarity on Wednesday.
Could they open before June 1, conceivably?
Yes.
Okay. And could I ask Dr. Levine to clarify something? He said that 700 tests over the weekend and 0 positives. Is that what you said? And if so, can you interpret that, please?
Yeah, so not over the whole weekend, over just the last day of the weekend. The reason we can't be precise about the 700 yet is because the UVM Medical Center does a small number of New York State tests as part of the health network at their lab in Burlington. So they have to subtract those out so we know the exact number that were done on Vermonters. But it will certainly be in that range. And there were 0 positives.
What does that tell you? I mean, that's remarkable.
I will agree it's remarkable, but I would implore you to recognize that over the weekend, we don't know how many, but a proportion of those tests were done on asymptomatic people who were either, presenting at one of our pop-up sites, were part of a sector that's being reopened, like the healthcare sector, to have a routine test, if you will. So it tells us that in the general population, that the numbers are indeed quite low. 0 is incredible, I will agree, but let's just call it the numbers are quite low in the general population of people who are feeling well. That's always been a concern in the United States because everyone has criticized the country for under-testing. And when you under-test, you actually don't know that big pool of people who might have infection, but they just don't act like they have infection or look like they have infection. So at least in Vermont, we know as we try to broaden that pool, we're finding very, very few cases.
And Stuart, I just want to remind everyone that we did see, I think it was Saturday, that we saw that there were 7 or 8 cases in one day. So it doesn't make for a trend either way. When you see 8, it doesn't mean we're rising, because the very next day it appears that we had 0. And we've had other days when it's been 0. But overall, again, the trends in Vermont look very good. And that's why we were able to have some confidence in opening up some of these businesses. But we continue to watch, because there's a bit of a lag time. We want to look back a week or two to be sure what we're doing, what we're opening, isn't having a detrimental effect on the status of Vermonters and their health. So again, we'll just keep watching the trends as we open this up slowly, methodically, to make sure that we're doing it the right way.
Steve?
Governor, your reaction to the Attorney General deciding to bring charges or enforce the rules against at least one business in Rutland? I'm sure Commissioner Sherling could talk to us about whether there are more in the pipeline.
Yeah, it's unfortunate that it came to this, and I know the Attorney General has bent over backwards trying to work with this one individual in Rutland, and has been doing so over the last week or two. But there's a sense of treating everyone the same. So if we're asking one business to do this, to have another go out and do otherwise isn't fair to the businesses that are doing the right thing. So I know it was difficult for the Attorney General to come to this conclusion, but I think that we put these guidance, these rules in place for a reason. And if there's going to be some parity against with all in business, we expect that to be followed. It's unfortunate because we're coming at a point, really, where we're starting to open up the economy. And if there had been just a little bit more patience over the next couple of weeks, I think you'll see that we'll be able to open up some of the businesses in question, or this business in particular. But I don't know, Commissioner Sherling, I'm not sure if there's been any others that have caused any concern, if you're on there.
I am, Governor. There have been a few businesses that have been found initially to be out of compliance, but in follow-up and additional education, the vast majority have come back into compliance. This is definitely a one-off, and I think you did a good job of describing the circumstances, so I'll stop short of editorializing further.
Well, again, most Vermonters, it's very impressive. Our numbers are impressive, but the rate of compliance in Vermont has been impressive as well. And it's due to the diligence of and vigilance of Vermonters themselves that have come to rally in this time of need.
Does this send the proper message then that there actually is a stick if you?
Yeah, I mean, the last resort is there is that stick that you mentioned. I'd rather deal with carrots and encourage people to do the right thing and buy larger amounts. People have done so. So, it's just unfortunate it had to come to this.
All right, we'll move to the phones, starting with Joe at the Barton Chronicle.
I believe this is a question for Dr. Levine. I am curious about whether the steps that were taken to make sure there would be both plenty of beds for the expected number of COVID patients and steps taken to make sure that people who weren't infected wouldn't get infected by going to a place where the coronavirus might be expected to be lurking. Whether that's had the side effect of increasing the number of illnesses, serious illnesses, and fatalities from people who weren't treated in the normal fashion.
Yeah, I will let Dr. Levine answer that. I think that has been a concern of many, that people are not seeking the treatment they need, and because of this, the coronavirus, COVID-19. So I'll let Dr. Levine answer.
That gives me an opportunity again to implore Vermonters who feel they're having symptoms not of COVID, but of stroke, of heart attack, of something serious, to always let that guide their actions and seek care for that. We have seen, not only anecdotally, but even statistically, I would say, less people presenting with symptoms of these very serious conditions to hospitals, to emergency rooms. And we don't for a moment believe that those conditions have somehow improved because coronavirus is amongst us now. So we're working with the medical examiner's office actually to make sure that we're not seeing an uptick in death rates regarding these other conditions, and it doesn't look like that is happening, thank goodness. But it doesn't mean that people aren't delaying care for conditions that could probably benefit by earlier care. So it's a great concern to have, and we're hopefully not seeing data that would indicate that something really bad has happened because of it. I will say that somewhat anecdotally, I think that people are afraid to go to healthcare settings, especially when they know that healthcare setting has treated people with coronavirus infection. And you would be hopefully very heartened by the fact that we don't know of cases that developed because somebody was in a hospital that had actually treated coronavirus. And in fact, some of our hospitals are really proud of that fact, and they should be. And we should really understand that if you have a serious condition, go to a hospital. It doesn't mean you are going to get coronavirus because you were exposed to it there. All of the protocols that are in place are there to protect patients and protect staff, of course, as well. And they're all very effective when they're adhered to very rigorously. So hope that answers your question.
I think it does. Thank you very much.
Mike Donahue, the Islander.
Morning, Governor. As a somewhat frequent visitor to the Grand Isle Lake Champlain region, you fully understand the importance the tourism trade means to the area. And obviously the month of May to October is what pays the bills for the local mom and pop businesses for the whole year. I'm just wondering, the northern border, Grand Isle, Franklin, Orleans, Essex, depends heavily on Canadian traffic. And wondering, since there are no tourists coming down, Lake Champlain, Memphis, Magog, the interstate or whatever, what is your economic package on Wednesday going to address the extra special needs for those 4 counties? What kind of relief are you offering for those 4 counties?
Yeah, thank you, Mike. I am very concerned about tourism in the state and what is part of our economy, a vital part of our economy. But I would add that it's not just the northern sections, it's also the southern sections and the eastern sections, the western sections. All told, the hospitality industry is under duress, and something that we are going to talk about on Wednesday. There is a portion that identifies the need there, and some of the package will be targeted towards that industry. So I'm not going to get ahead of the package or the announcement on Wednesday, but it will address some of the situation, because I've heard, again, speaking of the northern border, from our Canadian counterparts, it appears that they are not in any hurry to open up the border at this point in time because of what we're seeing in Quebec. And that's part of the regional approach that I've taken when I look at whether it's New York or Massachusetts or Connecticut or New Hampshire and Quebec as a region. There's still a great number of cases, positive cases, that are coming about every week. So while they're on the downhill side of this, I don't know about Quebec in particular, but I keep track of their number every day as well. But I will say New York and Massachusetts are in decline, but not quite enough so that we want to open up any tourism. But that's going to be, again, part of the equation as far as when we start opening up more of the tourism hospitality sector, is when they get healthy and when they're on more of the same footing that we are here in Vermont.
But I think there is a distinction. The northern border is shut off. There is still people coming in from New York, Massachusetts, and New Hampshire. Is a big distinction. With I understand the whole tourist trade is having a rough time, but when one whole border is shut down, it seems to be a little bit stiffer than the other 3
Yeah,
borders.
no, I can completely understand. But if we all adhere to the same, we open up the lodging by 25%. Hopefully, again, everyone's going to be impacted by this. I don't want to underestimate how difficult this is for those in the hospitality industry throughout Vermont. But if everyone is at 25%, hopefully, Vermonters will get out, explore, maybe explore. The Grand Isle County in particular is beautiful. I've spent some time there myself. But all sectors of Vermont, sections of Vermont, should hopefully be explored by Vermonters. Get to know your state would be my message to them.
One other quick follow-up. Store clerks and managers remain concerned for their personal health, and they're anxious that customers continue to ignore your wish, and that's what it is, a wish that Vermonters will wear a mask in public. And there's signs often that say no shoes, no shirt, no service. Not sure if that's a health department regulation, but what's stopping the state or the retail group from adding no masks to the no service warning?
Yeah, nothing prevents them from doing so. In fact, I would encourage them to do so if they're concerned. Obviously, we think masks are important, but it's the same. It's not a health department initiative, the no shirt, no shoes initiative. It's the same, on the same line as that. So I would encourage them to think creatively how they could implore many to wear masks. They might provide for some sort of incentive themselves for doing so, but nothing prevents them from doing just what you had described.
Thank you very much.
Sean, the Chester Telegraph.
Thank you. This is for the governor. Earlier in your statement, you said that there were about 14,000 new infections positives in New York. And we got a call from a reader who said that over the weekend, more than 24 motorcycles parked in a Dunkin' Donuts in Ludlow. No masks, no social distancing. They were there for 45 minutes, all with New York plates. And I know that you feel that education is the way to handle this, but it doesn't seem to be getting through. Is there something else that can be done?
Yeah, difficult because we can't shut down our borders. We just can't do that. The interstate commerce prevents that from us from doing that in any sense of the way. But we can try to guide people to take us at our guidance in terms of quarantines and so forth. But very difficult to do. And I know that this isn't a perfect system. But hopefully when they do come into Vermont, that they will not, again, get out and congregate in masses in some of our facilities. So, again, there's nothing we can do to prevent it. But our numbers show, again, that we've done the right thing. And we're on the downhill slide here, and as well as some of the regions, whether it be New York, Massachusetts, New Hampshire, Connecticut, Rhode Island, and so forth. They are seeing their numbers decline, and hopefully we can keep this going here in Vermont and prevent people from coming into the state to spread unnecessarily.
We're also hearing that a large number of people are coming just for the weekend to the resort Stratton, Okemo, at least in this area. And I'm wondering if perhaps in terms of the education that you're talking about, if that could be done more at the border.
Well, again, we've tried to educate people at the border in terms of signage and so forth, the quarantine period. But I would also say the guidelines for some of the lodging and so forth is asking people to quarantine. This is for in-state residents, so those who are coming in from other states aren't allowed actually to stay in some of the lodging facilities without quarantine, unless I've got that wrong. And I'd refer to Commissioner Sherling or Secretary Curley.
That's correct, Governor. At the moment, you can't use a lodging facility for other than essential travel. I would note that with updated guidance that was issued last week, that folks from adjacent states who normally are coming to Vermont as part of their day-to-day commute are allowed to be here also to recreate, because they're already coming to Vermont. So in the example of the motorcycle operators, it's unclear whether they were here from outside that area, but I would just state for general consumption for Vermonters that it is possible that you could see folks from adjacent areas of the adjacent states in Vermont doing basic recreation because they're already coming here as part of their day-to-day work life.
Thank you.
Steve, NEKTV?
Governor, can you hear me?
I can.
At the last presser, I had asked what specifically constitutional authority gave you the right to enforce and extend this state of emergency. Could you maybe have that section specifically for me by the end of this conference?
Yeah, I mean, that was on Friday. I did confer with my general counsel. She said that I was on firm ground with my statement. But I will have her reach out to you and give you that directly.
Okay, and one other quickly, if I may.
Sure.
The guy in Rutland with or the person in Rutland with the gym that was cited for non-compliance. If your orders carried the weight of law, couldn't he be arrested rather than cited? Yeah, well, again, this is Vermont, and we want to make sure that we're treating everyone with respect and civility, and we don't want to load up our prisons unnecessarily. So at this point in time, the Attorney General has taken the action he has and utilize that to our fullest weight of the law under the circumstances. So
we're not looking to punish people. We're looking for them to do the right thing, and I think that this is another step the Attorney General appropriately has moved forward with.
But very few people who are arrested are actually jailed. Aren't they offered bail usually?
Well, under normal circumstances, yes. I don't know. Again, I don't want to play the what ifs, but I think I just ended with. I think the Attorney General is doing handling this appropriately. He has worked with this one individual over the last couple of weeks, trying to provide again education, guidance, imploring the owner to do the right thing. And he has failed to do so. So I think the Attorney General is handling this in the best way possible.
Thank you, Governor.
Thank you.
Sasha, 7 days.
Hi, yes, this is a question for Dr. Levine, I believe. It's been about a month since the governor began reopening the economy by allowing some professions back to work. I'm wondering if any cases since have been linked to people returning to these jobs, and if so, what has the state done in response? For example, does the state shut down a construction site, or what exactly is the state's protocol if there's a positive case or a cluster of cases at a workplace?
I would just add, before Dr. Levine answers the question, that the guidance is clear on what steps have to be taken if someone has coronavirus on some of those sites. But I'll let Dr. Levine answer from his perspective.
From my perspective, I can't tell you about a case that might have been related to return to work. I will double check with my staff to be sure of that, but at the same time, one thing we're not seeing in Vermont over these last number of weeks is the word clusters. And that's part of what we do in every case, is really investigate it fully, do all the contact tracing, see if we actually do have a cluster. The most recent thing that you could even characterize as a cluster was in the school in Bennington, where a couple of cases were found in the staff and maybe one of the residents of that facility. But it was very self-contained, and it certainly didn't have anything to do with return to work. So I can be pretty reassuring that all of the energy that's been devoted to getting people back to work, those who can't telework but have to be at a work site, like a construction site, we're not getting reports of clusters. And I do have to say that, just like with our long-term care facilities, a lot of this work has to be preemptive and proactive. So all of the guidelines and regulations that have been put in place as Vermont's restarting has occurred have had significant public health messages and guidelines for everyone to adhere to before they even return to work. So the rules of the game are very clearly stated. The guidelines regarding the practical steps that everyone should be taking on a day-to-day basis as they go about their business at work, the education that's been part of the proposal that has gone out to everyone. That's all very much proactive and preemptive work, so hopefully we're finding that that's paying dividends as well.
Just a quick follow-up. So does that, based on the number of cases, and does that mean you think these turns of the spigot have been successful thus far?
Yes, I would be able to say that. Based on, we had the graph I showed you initially, there's literally less than a couple of cases a day for many, many days in a row in the last week or two. And though there are oscillations, as I pointed out in that data, we're not seeing steep upticks in the data. So things have gone smoothly up until now. You have to always keep in mind that the impact of a change takes at least 2 weeks to look at in terms of new cases developing, and may take even longer than that when it comes to looking for hospitalizations, things of that sort. But certainly not seeing things of concern, and that's why the governor has said at each press conference that we're going to continue to open up little by little each time, but watch that data very, very carefully. And we're not just watching the data for what it's worth on the day it occurs, we're looking at it as what might have happened weeks before that led to what we saw on the day that it occurs.
Great. Thank you very much.
I just would like to add, I know that Dr. Levine had talked about being proactive, which we've been able to do with our increased number of testing and tracing capacity. But we'll also be very reactive. If we determine that there is an outbreak or a positive test in one facility, let's say, I would say that the health department would surround this, trying to make sure that we extinguish that ember and trace where that came from and probably test many within the facility.
All right. Colin, VT Digger.
Yeah, good morning. Can you hear me?
We can.
I had a question for Dr. Levine. I was wondering from a public health perspective what your advice has been to the governor in terms of advice versus orders on things like social distancing and wearing masks.
I hope you'd like me to say that those are good things to do, and he should adhere to them in his own personal behavior and encourage Vermonters as well to adhere to them, because that's really what the advice has been. You know, from the unfortunately from the first week in March when we saw this coming and we were very carefully watching our cases, we knew that in the United States, containment wasn't going to be the strategy that was going to work. Just isolating and contact tracing and quarantining was not going to be successful by itself, even though it needed to occur. But in the United States, we needed to immediately go to these non-pharmaceutical interventions, so-called mitigation strategies, the most supreme of which is, I will call it, physical distancing. And physical distancing is sort of the foundation that everything stands upon. As you know, we've added masking, facial covering to that subsequently, but from a public health standpoint, that was the most important thing that needed to be initiated, and the behavior change in people's lives. And that behavior change was only then further supported by all of the different aspects of the emergency order that the governors developed over these ensuing weeks from that beginning in March, up and through the stay home, stay safe, being sort of the ultimate way of making sure that physical distancing can occur. So,
do you think that an order that could be followed up with enforcement actions would increase compliance around the state?
I think the record stands for itself. Vermonters have been incredibly cooperative and incredibly compliant, and as we've even said in the past, they've sacrificed. So they've done everything that needed to be done to adhere to this without a lot of enforcement occurring. I think this Rutland episode is maybe the first thing we've heard of with regard to enforcement, and look how late in the game that is. So I think from my standpoint, people in Vermont understand health and public health and compliance very, very well.
And what is that statement that you just said based on? You said people have been incredibly compliant. We get tips that in places sort of like the Northeast Kingdom, for example, compliance is actually quite low. You've talked about a steady stream of tips about people concerned about their neighbors not complying. Where do you draw the confidence that people are really following this in such a slim number?
So at some of the Friday presentations that Commissioner Pichak has done, we actually portray if you will, the Google Internet aspect of social distancing by portraying density of vehicles on roads, density of people and crowds. There's metrics we can show without just sort of inserting ourselves and looking around for people who are getting too close to one another or what have you, that indicate that for periods of time, Vermonters have actually stayed in as they were instructed to, that there wasn't that kind of person or vehicle mobility that you would see in normal times. So that's the kind of data that we try to rely on for that.
Gotcha. And then just lastly for the governor, I'm just wondering, you talked a lot about a data-driven approach, and I'm wondering how that data-driven approach sort of is considered when you look at whether or not to order masks, particularly in businesses where people are going to be coming into close contact.
Well, again, we're watching the data, and when we've opened some of the businesses and facilities, we've asked employees, we've asked the employers to make sure their employees are wearing masks and social distancing and following procedures and temperature checks and surveys and so forth, and report anything that might be looked at as concerning and an outbreak. In terms of what we've seen thus far, again, I have to say, on Saturday, I believe, as Dr. Levine had spoke about, we had 700 tests, and we had 0 positives. I'm not sure how much lower we can go than 0. So we'll continue to monitor the data, and I'm not arrogant about this. If we see that the data isn't supporting what we're doing, we'll take action. We'll drop the ego, drop the politics, and do what's best for Vermonters. And again, we don't know. We've evolved on this a lot over the last 2 months, and I expect we'll be evolving further over the next 2 months as we see other states. We learn from other states what they're doing or not doing that would either be helpful or harmful to Vermont, and we'll learn from them, and we'll learn from our own actions. So again, if we see something happening, something detrimental to Vermonters that we think we should take action, we'll do so. But the numbers are showing that we're moving in the right direction. Again, when you look at last week, we're the envy of the nation in some respects. I have governors texting me and saying, you give us hope. So what we're doing is working, and when we see otherwise, we'll take action.
Thank you, Governor Scott and Dr. Levine, for your time.
Tim, Vermont Business Magazine.
Hi, Dr. Levine. I'm not sure if you saw this, but over the weekend, an aircraft carrier that had been seeing a lot of positive cases had seen new positives from sailors who had supposedly recovered, and we seem to be counting a lot on this idea of herd immunity. Can you speak about what if there isn't a herd immunity and what that might mean for, if you've seen this study, and how that could affect policy going forward, not only in Vermont but across the U.S.?
Yeah, thanks for giving me that question. I think using the word study would probably be elevating this report a little higher, because I don't think it's a study quite yet, but it is sort of a report of what's been seen. And these sailors apparently had tested negative and recovered after their initial illness, and then became ill again and tested positive. So the big theme in infectious disease has to do with the words relapse and reinfection. Relapse being more or less an ongoing infection that seemed to have simmered down and then sort of peaks again, versus reinfection where you actually were sick, you got completely better, you had freed yourself of that infection, and then infection was reintroduced and you became ill again. So really, that's what people are trying to establish, is what do these sailors represent? Do they represent somebody who really was free of the virus and then got reinfected again? or did they actually just, for some reason, reactivate the illness that was already there within them? And this brings up a little issue about testing, too, because testing in the same individual can sort of have positive days and negative days. Sometimes that has to do with how much viral load there was at the time. And it's very challenging to sort of figure that out in an individual person. This has been reported not only on this aircraft carrier, but in other countries. I believe South Korea had the same thing happen with a number of COVID-positive people. So it's a little unclear what it means, and the implication for herd immunity is even less clear because we're still not completely certain that being infected once with coronavirus that causes COVID-19 is actually going to make you immune the next time around, or at least hopefully have a less severe illness the next time around. And with coronaviruses, besides this one, we have experiences in human beings from the past that can go either way. People can get reinfected but have a less severe illness, or people might actually not get infected again. So that's a little bit challenging. If I could be encouraging, though, one thing that also came out very recently is that one of the initial vaccine trials, the vaccine was demonstrated to produce antibody, to show an anti-immune response in the individuals who got it. Doesn't mean that if you actually expose them all to SARS-CoV-2, which is the virus that leads to COVID-19, doesn't mean if you expose them to that they would have been immune and not had any problem with it. But this is an important early finding that at least the vaccine was able to stimulate the immune system in the people who got it. So that gives us great hope for down the road when it really does go into larger trials that we may see some benefit. But again, this is nothing immediate and nothing conclusive for how effective it will be as a vaccine in the future. It's just an important early step, an important hoop to have jumped through successfully.
So at this point, it's not really affecting policy, any of these early studies, either this vaccine or the aircraft carrier issue?
No, it really can't, unfortunately.
Okay, great, thank you.
I just want to give credit to Dr. Levine because from the very beginning he has said we can't count on herd immunity or viral immunity to those who've already had the coronavirus because it's such a new strain that there was no studies to back that up. So he's been warning us that we can't do this too quick, that we'll learn a lot from, I know Sweden has relied heavily on this, and they may be wrong. We don't know yet, but we'll learn as we go along, learn from other states, learn from other countries, and develop policies that will help, again, protect us and hopefully develop a vaccine in the not too distant future that will prevent us from getting this at all. So that's the hope.
All right. Taylor, Channel 7.
Can you hear me?
You can.
All right, so this question I have is probably actually for the governor. As we continue to see positive trends with this virus, can you speak on behalf of possibly allowing college students to retrieve their belongings that they might have left at Vermont, colleges and universities? Do you have any idea of when that might be?
We've had that conversation, and I believe that we have a plan in place, but I can't tell you what it is at this point. But we had a detailed conversation about doing just that because we know that college students have to come back and get their belongings, clean out their rooms, and hopefully we'll get to a point where we're welcoming back students in the fall, but that's not for sure at this point, but we want to prepare for that. Dr. Levine?
Yeah, and just to elaborate, we've been talking with a lot of the colleges over time, and it does seem to be like the right thing to do. And as long as it's done in a way that is scheduled, that is protective of everyone else in terms of carrying out all of the same policies we've been talking about with distancing and masking, but also making sure that people understand this is not like I'm going to have a wonderful Memorial Day weekend in Vermont and pick up my kids' belongings. It's essentially drive in, load a car, and drive home so that we can exempt them from a quarantine for 14 days just to pick up something in a room and return home with it. So we're trying to be very protective of them, at the same time protective of us. And I think it'll be a satisfactory solution to that.
Right, thank you, guys.
Liam, VPR.
Hi, Commissioner Levine. I was wondering just a little bit more, for a little bit more detail about the testing this weekend at the pop-up sites for asymptomatic people. Do you have the total number of tests that you did at those sites so far, and any sense of what percent, what the results of those tests have been?
I'll ask Secretary Smith to give you some of the details on the numbers, because I think they were interesting, because many of them were 408, and I believe that they were there was no more capacity at many of the pop-up sites.
Liam, let me just give you the dates. 5/16, we were in Hartford. There were 360 that were registered and tested. And on 5/16, that same day in Colchester, there were 408 that were tested. As Dr. Levine said, over the weekend, I believe there was 8 positives on Saturday night, but 1 was from a pop-up. And as the governor has said, on Sunday night, there were 0 that tested positive. Let me just also, while you've given me the chance to broadcast what's going on, tomorrow we will be at tomorrow we'll be at Barrie, and there's registered 408. There's 0 slots available. On 5/20, we're at Middlebury. We've registered 408. There's 0 slots available. In St. Albans on 5/20, we registered 408. There's 0 slots available. Newport, on 5/21, we've registered 186. There's still 343 slots available. In Springfield, we've registered 306. There's still slots available there. In Morrisville, 5/22, we've registered 340. There's still slots available there. And in St. Johnsbury, we've registered on 5/23, 230. There are slots still available at those locations. So Hartford, I haven't mentioned that we tested also on 5/14 Brattleboro, and there were 346 that were tested there. So I hope that answered your question.
Yeah, and a follow-up, Secretary. Are you planning to continue to kind of do regularly move through and do testing at these sites going forward? Because I mean, as you've spoken before about universal testing, testing like this is just a snapshot. So if we do all these tests over the week and then don't really keep doing it, it doesn't necessarily tell us much more than what happened at the moment we did the test. So will this become a regular part of the state's mitigation strategy, that we'll be just cycling through these test sites?
It will, but I think you'll see it transform into something larger as well, not only sort of pop-up test sites, but also sort of how do we integrate this into the existing healthcare system, whether it's the FQHCs or hospitals or even pharmacies. How do we integrate this entire testing protocol so that we can say anybody that wants to test can get a test? How do we do this in a permanent basis? So I think what you'll start seeing is the integration into the healthcare system, perhaps the pop-up as we continue on a basis where we need that and where we see some gaps in this procedures, but also pharmacies, perhaps even Walmart and some other areas as well, that we will encourage testing and having a sustainable testing program as we move forward. We're in discussions right now to talk about all of this.
And how do you make sure that vulnerable populations, such as elderly folks in long-term care facilities and folks that even aren't in those facilities that might be living at home, folks in prison, how do you make sure that all of those are also going to be able to have access if the general population also does and can test regularly?
Well, on Friday I had mentioned that any long-term care facility that basically wants to be tested will test. If they want to be tested, we will test them. In fact, on long-term care facilities, we've gone to a more aggressive testing capability where we'll test multiple times over multiple days in order to make sure that we have sufficient information coming out of those facilities. In terms of facilities like corrections, and I said this on Friday, testing has been evolving, just like everything else in our discussion about this virus has been evolving. And we, as you know, back in April, started asymptomatic testing of correctional facilities by testing, if we had just one case, testing the entire facility. We have done that. We evolved it into testing staff, and we're evolving it now into, for example, today we'll be testing both inmates and correctional officers at St. Johnsbury, and that policy will continue. We'll start moving through the various aspects of those facilities, but. When we talk about making sure that Vermonters that want to test get a test, this is an ongoing basis that we're talking about, and it will take an effort and protocol in order to put this in place, but that's our objective.
Thank you.
Wilson, AP.
Hi, I have two questions. One I think is pretty, actually perhaps they're both simple. Where are pools and health clubs in the reopening queue? Oh, and then the second one is, there's always talk about testing now. Wasn't there talk a few weeks ago about some sort of, and forgive me if I get the terminology wrong, some sort of antibody test to try and figure out how many people in the population have been exposed to this who perhaps no longer have active coronavirus but have found some way to respond to it? So those are my two questions.
Thank you, Wilson. The first one I'll answer, and then I'll let Dr. Levine answer the second. What you're referring to with health care or health facilities, gyms and so forth, are part of close contact businesses. We're hoping that we're able to make some announcements before June 1st for some sort of a measured opening, probably similar to what we're doing with other facilities and a much reduced capacity. But we're really hoping that we will be able to announce all the businesses in some respects to be open in a limited way by June 1st.
Okay, thank you on that one.
Hi, Wilson. Dr. Levine here. So I imagine on Wednesday I'll be, as part of my prepared comments, discussing the deliberations of the serology working group that I had assembled that met for its second time late last week, and they're submitting their recommendations back to me. But in answer to your specific question about the serology testing, I can foreshadow what they're going to say a little bit in saying that these tests might not be ready yet for use on decision-making on an individual basis. When I say that, it means like something that's been commonly referred to as an immunity passport. If you test positive, you can go anywhere, do anything, you're invincible, you're not going to give anybody else COVID. Those tests are not actually felt at this point in time to be valid for that use. So stay tuned, and I'll have a more complete report on Wednesday because I'll have received it by then.
Okay, but from a public health perspective, which would prefer give you the better information? Would it be the testing that's going on now, or some sort of antibody test? Or, what percentage of the population has this?
Right.
I want to say immunity, but I realize that's probably not the right word.
Right, but you've qualified it the right way, so that's perfect. So the answer to your question is each test has a different purpose. So the kind of testing we're doing now, which is nasal and nasopharyngeal specimens, is to look for active virus, somebody who has the ability to either come down with COVID-19 if they're not symptomatic, or has COVID-19 as the reason for the symptoms they presented with, and could potentially transmit that infection to someone else. So it has to do with detecting active viral RNA, actually. The serology or antibody testing we're finding would most likely have a utility as what we call a seroprevalence study, meaning how many people in the population have come in contact with the coronavirus, even if they didn't know it because they never had a real illness, or they did know it and they had a real illness. So how many people in the population can we say may have had an active infection with it? We're thinking in this country now, most states, it would be under 10%, sometimes significantly under 10%, but we'll learn that as these tests become more commonly used. So again, very different purposes. One's just to see what your population's experience with the virus has been. The other is to find out if there's active sites of viral infection that need to be addressed and prevent transmission to the rest of the population on an acute basis.
Okay, thank you.
Chris Roy, Newport Daily Express.
Yes, good afternoon. We're hearing from readers if they may have their flea markets and yard sales, and if they may, what will that look like, and if they have to abide by any particular regulations like retail stores have to do.
Yeah, we haven't, I don't believe we've addressed flea markets and yard sales, but let's just say, let's take garage sales and yard sales, for instance. If you have fewer than 10 people in one setting, that would be okay. What we would like to see is everyone taking protection, making sure they protect themselves and others when they come and look at some of the items you have for sale on your front lawn or in your garage. So protect yourself, take the most appropriate measures, and you should be fine. Flea markets are a different situation, and I'm not sure at this point. So we'll have to take a look at that.
And do the people who are running the garage sales or yard sales have to enforce that and ask people to leave if it gets to be too crowded?
Well, I would think in their own best interests, they would want to keep it at a minimum. Again, from what I've seen anecdotally over the years, and typically with yard sales and garage sales, I wouldn't say that there's a vast number over 10 at any one particular time, but I would think that they want to protect themselves and others during those sales.
And does the 10 include the people running the sale, or just
Yes.
the customers?
Yeah, it would.
It does. Okay. All right. Thank you.
That. Yes. Thank you.
Okay. Thank you.
Greg, the County Courier.
Hi, Governor. Although I'm not there in person, I've seen video of your press conferences. You're looking, although a bit tired, like any leader would be going through this for, going on 2 months now. You're not looking shaggy like the rest of us. How are you getting a haircut, and how are you getting through this?
Well, I'm not getting a haircut. So if you probably take some before and after photos, I think you would see that my hair is getting quite a bit longer. but I have to do, like everyone else, trim it myself when necessary, and use a little product on it to keep it in place, and look forward to the hair salon's opening.
And just a quick follow-up, up in our area, I have heard that there are some cosmetologists that are doing work for people in their own homes, traveling to the customer's home to do it. Is that against the current order?
It's a good question. I just don't know. I wouldn't say it's against the current order, but I don't know what guidelines that they have to follow in terms of their licensing. So that would be my only question. But hopefully, again, they'll receive some good news this week if we continue to hold the numbers the way we are, and they'll be open before you know it.
Thanks, Governor, and I guess you can give the rest of us some tips on how to cut our own hair. Thank you.
Chris Mays, Brattleboro Reformer. Chris, it's *6 to unmute. All right, we'll go on to Joel, the Burlington Free Press. Joel, Burlington Free Press. Okay, we're going to move to Andrew, the Caledonia Record.
Yes, good afternoon, Governor. Thank you very much. Wondering if you have any anticipation of when youth sports, competitive athletics might be able to resume, Little League, summer hockey schools, and I would imagine at some point the high schools are going to want to start thinking about the fall. If you have any thought on what the metrics are that you're looking for with that, and any anticipation.
Yeah, I can't say that we've looked at that in depth. I will say contact sports are a concern to all of us, but I think we'll see that individual sports, if they can maintain some distancing, non-contact, and so forth, we might be able to do that in the near future, whether it be Little League softball, something where there's not, where you can again maintain that distancing and non-contact. May change the rules of the game a bit, but we want to encourage people to get out and enjoy themselves, but protecting themselves at the same time. So we'll continue to look at what the fall looks like in terms of high school sports and college sports and so forth. But I think you can look again at what's happening nationwide, worldwide, in terms of some of those organized sports, and they're struggling as well. To how are they going to provide for that and protect their players as well? So we'll look at what they do, as well as consult with Dr. Levine and some others amongst our team to see what we can do to open some of these areas up, so that we can get back to some sort of normal.
And just to follow, when you say contact sports are concerning, do you envision the possibility that those may not be able to resume until perhaps even a vaccine is in place, or would there be other benchmarks that would need to be met? I
wouldn't go as far as to say that, but certainly we want to make sure that whatever we do protects as best we can. And so we'll be watching. Again, there's some other priorities that come before that, before some of the organized sports. But we've seen how far we've come. Again, in the last 2 months, things have changed. But in the last 3 to 4 weeks, things have changed as well. And we've been able to open up some of these entities, and we've seen some of the data that gives us great hope that we're moving in the right direction. And hopefully other areas of the country are as well. So we'll continue to watch and trying to do what we can and learn, again, from other states, other countries. We don't have all the best ideas, so we can learn from each other And I think that that's going to be more important than ever as some of these states and countries experiment a bit and learn from them, and then develop some of the procedures within our state that would provide, again, for some normalcy in the future.
Okay, thank you.
Michelle, the St. Albans Messenger. Michelle Monroe, St. Albans Messenger. Okay, we'll move to Brittany, Local 22.
Hi. So just a quick question. We've had a couple of viewers. Oh my goodness. So we've had a couple of viewers write in and say that they're concerned about childcare reopening and that they think it just might be too soon. I was wondering if the governor has heard any of these kinds of comments. And also, what would you say to people who are scared, for their children's health and safety and their own health and safety?
Yeah, I have heard that there is some dissension amongst the child care providers. Some are wanting to get back to work as soon as possible. Others aren't ready at this point. We're trying to work with them to the best we can. Again, we know that we need child care in order to open up some of the economy, and because people need to get back to work, but they need a safe place to keep their kids. So we're working diligently to try and thread that needle, so to speak. I'll ask Secretary Smith to comment on it as well.
Thank you, Governor. One of the things that I keep referring back to this because it's so important what we did during this crisis. We kept financial stabilization within the child care industry. In fact, we knew that when we came out of this, child care would be needed as we move forward. So we put in a financial assistance program in place to keep the infrastructure of child care in place. That was not insignificant. It was millions and millions of dollars in order to put that system and keep that system in place. As we move out of this, we're not requiring child care centers to open. If they don't feel safe, then we will. They don't have to open. At the same time, we have said we will put a $6 million grant program into place in order to purchase those things that, and I'll ask Dr. Levine to talk about the health aspects of this, but to put in place those aspects that are very important in terms of making sure the cleanliness, the hygiene aspects of these centers are maintained. And this decision to reopen was made on a health basis. It wasn't made on any sort of financial basis. It was made on a health basis. And many of the things that the health department put into place in terms of guidance, if you look at the guidance, is fairly stringent in terms of what has to happen along the way. And as Dr. Levine said last week, many states are looking at Vermont in terms of those requirements we put in place. Not only did many states look at Vermont with envy, may I add, on what we did in keeping the infrastructure in place on child care centers, now they're looking to Vermont on how to open those child care centers. And we're opening it by making sure, A, they have supplies, B, we have money in order for them to purchase the supplies, cleaning equipment in particular, and B, that the C, I guess, is the safety aspects of opening up, and I'll let Dr. Levine talk about that aspect of it.
Yeah, just very briefly, certainly no one would want to bring to the table any kind of recommendations or practices that would be not in the best interest of kids' health or adults' health. And there are plenty of places to look. Vermont has been very progressive in their recommendations, and they are being adopted by other states. but we're obviously working closely with the Centers for Disease Control. We're working closely with the pediatric community, with many of the other organizations like Building Bright Futures, et cetera, to do the right thing. And it turns out for kids, sometimes the impact of social isolation is actually a worse outcome than allowing kids to get back together. And one can keep the risk to their health, getting them back together, as low as possible through all of the guidance that we have been producing to guide that profession, if you will. I can make another just quickly general comment. It wouldn't be Vermont if everyone felt only one way about one problem. Wouldn't be probably any state. But, you know, it's interesting. We all get a lot of communications from Vermonters, and there are definitely people, Brittany, that had the opinion that you stated, but there are many others on the opposite side. And we find the same thing, even something as simple as what the governor alluded to earlier, maybe having outdoor dining at restaurants. Well, it turns out a lot of people will find that to be a wonderful thing, but there's also people who will find that to be horrifying. And they say, I'm not going there. There's no chance that you'll find me there. And for any other issue that we would bring up that might be true as a general rule of thumb, even opening up the healthcare profession again, turns out a lot of the people waiting for elective outpatient surgical procedures really couldn't be cajoled into coming back into the healthcare system. They were like, I think I'll wait. I don't need that procedure right now, even though the opportunity was now available to them. So it's been a real challenge to all of us psychologically to get through this. And even as we try to come out of it, we need to be respectful of the fact that there's going to be a plethora of opinions and comfort levels with anything we do or don't do, for that matter. And I think that's just human behavior, and we should be accepting of that and understanding.
Thank you. Thank you so much.
All right, and I think I heard Michelle pipe up just as we went to Brittany. So Michelle, if you're still there.
Hello, I'm here. Can you hear me?
Yeah, go ahead, Michelle.
Thanks, Governor. My question was about paid leave and what that could mean for containment of the virus. So if I'm someone who works, for example, in a small retail outlet, and I learn that a family member or someone else that I have frequent contact with has been diagnosed with COVID, and I'm contacted and they say, we'd really like you to quarantine to see if you develop symptoms, and you're going to need to get tested in a few days. What happens if I'm working in a business that doesn't provide any paid time off, and now I can't leave my job and get, you see the conundrum here of folks who are asked to stay separate but don't have access to paid leave?
I believe unemployment would kick in, and I'll defer to Commissioner Harrington, but I believe that you can collect unemployment in those cases. Commissioner Harrington?
So just for a week or two?
For whatever it takes, I guess.
Yeah, so if an employee is out of work, and if I missed part of this question, just let me know, but if an employee is out of work, even if it's temporary for a week or two, and they fall under one of the COVID-related reasons, whether the employer falls under that in terms of temporarily laying them off, or if the employee is temporarily laid off, for a couple weeks, whether it's due to their own health-related reason or that of a loved one or taking care of a family member, they would be eligible even if it were for a week or two. So there is no minimum. It really is based on a reduction of hours and a reduction of wages depending on the situation.
So I would have to essentially leave my job and apply for unemployment for the time that I've been asked to be in self-quarantine.
If you were asked to be in self-quarantine, you essentially would not be able to work, and therefore you would become eligible as long as you met other eligibility requirements. But in most cases, under these circumstances, people they would become eligible for unemployment insurance if they were asked by a healthcare provider or specialist to stay home and quarantine, either due to a risk of exposure or because they had contracted the disease.
Okay, thank you.
All right, I also got notice that Joel from the Burlington Free Press was back.
I thought we answered him. No? Okay. That's confusing. Sorry, Joel.
Joel, are you there? Okay, Joel, last chance. All right, we're going to go to Kat at WCAX.
Hi, my question is about alternative medical businesses, chiropractors, acupuncture, massage therapy. Just to be clear, are those open yet? What's the guidance around those right now?
I'll let Secretary Smith answer that.
They are not open yet, Kat, and what I will say is stay tuned for the end of the week. That's all I can give you right now.
Okay, so if we're hearing people like booking appointments, they shouldn't be doing that yet?
They shouldn't be doing it until the end of the week.
Thank you.
Avery, WCAX.
My question is probably both for Governor Scott and for Dr. Levine. First, for Dr. Levine, a lot of retail stores have banned reusable bags. Is there a science to support that those bags transfer viruses or are more unsanitary than using plastic bags? And for Governor Scott, how's the state looking on the plastic bag ban come July?
I think Dr. Levine has actually answered this before, but I'm going to ask him to comment again. I don't think there was anything conclusive in terms of any of the data showing that reusable bags were carriers for this virus. And so at this point in time, we're still on track for July 1 for the plastic bag ban, I believe. Maybe I could ask. Maybe I can ask both Secretary Moore and Commissioner Levine to answer both parts of those.
So part of the answer has to do with, can a virus survive on a non-human being surface, whether it be a metal surface, a podium, or a bag of some sort? And the answer is you can find virus on any of these if you try hard enough. Doesn't mean, though, it's a virus that's viable enough to infect a person once it's left the body and is now sitting on this other surface. I'm going to go out on a little bit of a limb, but I will correct myself next time if I'm wrong. But I believe the reason some of the supermarkets do not want to have the reusable bags is because those bags have been touched by the person who brought them in. So they could actually be a vector, if you will, for disease, even though it's just that person's bag and they're bringing it home. And so the clerks who are doing the bagging won't bag in one of those, but they will certainly bag into one of their own paper or plastic bags that they have at the store. So I think that's how that whole thing got started, is just they were forbidden to use the bag that the customer brought into the store. Secretary Moore?
I would just add that most of the outreach we've had regarding single-use plastic bags relates to folks' existing inventories and their ability to use existing single-use plastic bag inventories up as we get towards the July 1st deadline, particularly for businesses that may have been closed for an extended period of time. There are allowances made for that, and beyond that, the conversation about moving away from the plastic bag ban has been fairly minimal, and we anticipate it going into effect July 1st.
Okay, thank you.
Aaron, VT Digger.
I first have a quick question for Dr. Levine. Why did the state report fewer tests this weekend than it did on Friday? Total tests completed.
Can you be more specific about the numbers you're talking about?
Sure. On Friday, the state reported 23,000 tests completed on its, Vermont COVID data witebsite, and then in subsequent days reported less than 23,000. I want to say it's 22,700 something. That would be 22,600 something, which makes it look like the state has had negative tests done. I was wondering what was going on. Was the Friday number like an over-reporting issue, or are there like more tests that are going to be added this week that were mistakenly added on Friday?
I think you've got all of our collective curiosities up, and we're going to have to find the answer to that question for you. I can hypothesize a little bit, but I don't want to be wrong. Part of the issue may be the sorting out of the tests that were done by UVM on New York residents, but I don't know that for a fact, so let's just get back to you at the next press conference.
Okay. I was also wondering about the town-by-town data the state has been releasing. It's been doing it kind of a separate location on the website than the regular data portal, which makes it harder for people to view the underlying data, and it doesn't preserve the historical data, so it just preserves shows a current snapshot rather than what it looked like last week. Are there any plans to make that map a little bit more clear and available for researchers, data journalists, and the public?
So if I could ask you to connect with my communication staff with a more precise description of exactly what you liked before and what you think we need to add back now so we can analyze that, because I think I'm having trouble visualizing exactly what your concern is as I'm thinking of the map and the way we portray it. And I want to make sure it's not just the way you're accessing it versus the way we're portraying it.
Okay, thank you.
I just want to make sure we don't start something. Dr. Levine has stated that it may be because of the New York residents being tested in the UVM lab. I just want to be clear. Those tests are done in New York, on New York residents, and it just happens to go through the hospital there in New York and come to the UVM lab to be tested. So that I just want to make sure we're clear on that.
Thanks.
All right, Ham Davis.
Am I in?
Yes.
Am I in?
Go ahead, Ham.
Thank you. This is a question for the governor. We've got great numbers in Vermont, and that trend is continuing. It's not guaranteed, of course. What I'm curious about is the extent to which you've thought about what seems to me to be the real problem on the horizon that hasn't happened yet, which is the possibility of a second wave. And when you look at that, I think an example would be is the one that the governor mentioned earlier, which was the party that took place in Plattsburgh. New York is really not one state. New York is about 8 states, and one of them is the North Country of New York, which actually bears a considerable resemblance to Vermont. It runs from Watertown, New York, to the shore of Lake Champlain, 6 counties. And so that opened up just about a week ago, and it had to meet a lot of stringent requirements. Its numbers, we're not talking about New York, Manhattan now. We're talking about including the Adirondacks, where almost nobody lives. So what I'm curious about is this. Have you thought about that? What kind of thing would you really be looking for to decide the difference between the signal and the noise? Just a little blip that came up that wouldn't mean that much, or something that where somebody, whether it was Mike Pichak or Dr. Levine would start to talk, would call up the governor and say, do we need to think about going back to the spigot and turning it the other way? And to put it in a hard news question, Governor, if you were governor of the six counties of New York, the North Country of New York, and you got that party in Plattsburgh, what would you have done about that? Would you have gone back to the? Would you have rolled anything back, or would you have considered it noise?
Ham, I appreciate the question, but I'm having enough trouble running the state of Vermont without having to run New York as well. So I'm going to let Governor Cuomo answer that one. In terms of Vermont, though, I think you hit upon something that's really relevant because we do have to prepare just in case something does happen. We don't know what's going to happen in the fall. But I know that there's a lot of talk about the resurgence of the virus, so we want to prepare for that. I don't want to relive what we've gone through. I don't think Vermonters want to relive what we've gone through over the last 2 months. We've made a lot of gains. We've probably made a lot of mistakes. We'll learn from those mistakes and do things better in the future. The more we learn about the virus and the spread and what happens, the more we're going to be able to control it in the future or mitigate it as best we can in the future. Increased testing is going to be, tracing is going to be really part of the mix as we move forward without a vaccine. So if we'd had the testing in the beginning, maybe we would have done things differently, but we didn't. So we had to deal with what we had. In terms of different parts of the state, I think that's exactly right. The northern part of New York is not like Manhattan and New York City. But I would also say that the Northeast Kingdom isn't like the greater Burlington area. So what we see in the greater Burlington area might not be the same in other parts of the state. So can we regionalize? It's the same with New Hampshire, by the way. Lower southern New Hampshire is not like Groveton up in northern part of New Hampshire either. And Maine is having the same issue. So again, I think we're going to learn a lot from this. We're going to talk as a region. We're going to talk as individual governors about what we can do differently should the second wave come about. So it's on our mind. It's on our radar. We're trying to plan and prepare just in case it does. But how do we control it in the future? Dr. Levine, anything?
Thank you for that, Governor. But let me just suggest something that makes the problem, I think, real. I understand that you're not the governor of the North Country, although the North Country might prefer that you were. But the reality is that if right now, UVM, St. Mike's, and I believe Champlain are all planning on opening in the fall, and in many ways they absolutely need to. And so what that means is that in about a 5-day stretch in late August, we're going to dump at least 15,000 students into the Burlington-Winooski area that are coming from all over the place. And so my question is, have you started to think about what metric would you look at to decide whether what you had was a systemic problem, or was simply a problem that you just had to deal with like any other spike? That's my question.
Again, I'm going to ask Dr. Levine to answer part of that, but I would say this, as we contemplate the reopening of these different sectors, whether it be higher education or a facility, a manufacturing facility, we're going to have to do it in a different way. We're not going to all of a sudden have 15,000 people in our area. We probably will try and stagger in some respects. We're going to have to test. Hopefully there'll be more testing available, maybe in a quicker fashion, to be sure that we are taking care. There'll be some quarantining, I would think, initially. But that's, those are things that we're contemplating as we open into the fall. So again, it'll be similar to some of the sectors that we've already opened. It'll have to be in some measured fashion, and tracing and testing will be a part of the mix as well. Commissioner Levine.
Thank you.
Thank you, Governor. And Ham, just to add one or two things. I think we would manage what's going on in Plattsburgh identically to what they're doing. What they've done is there was a party identified, there were cases of disease from that party, and there were abundant contacts. So to use the analogy that so often is being used here in our government, there was a brush fire that occurred, and we're sort of surrounding it, we're taking care of it, everyone's been isolated and quarantined, and we're making sure there are no burning embers anywhere else, and that will be a self-contained incident that will hopefully take care of itself. It allowed the public health infrastructure, and I assume the city political infrastructure, to again remind the public that we tell you to do these things for a reason. Having that kind of a party was not exactly the way we thought that we would be reopening New York State, they would probably have said, and that we would like to make sure that everybody respects the social distancing and facial covering edicts that had come down in that state. So that's probably how we would have handled that part as well. But in terms of looking at the future, if we truly have a resurgence, we will be very carefully looking at not only the daily new cases of disease, but I would presume it would be not just one party in one town in Vermont. It would be fairly dispersed around the state, so that syndromic surveillance data, how many people are actually complaining of symptoms all of a sudden, whether they live in Bennington, whether they live in Burlington, doesn't matter. We will begin to find that that was happening with more frequency, and that would be an early tip-off, if you will, that things are happening out there. So I think we would continue to just keep our eye laser focused on all the data that we've been focusing on. With regard to students coming back, there really would need to be quarantine procedures in place, and all the schools are very aware of that, at least if the students are coming from outside Vermont, so that there won't be any surprises, and there would be an orderly and, I think, methodical approach to that, so you didn't have 15,000 people all at once having to do that, but you'd be able to provide for that. So that kind of activity is what is on the schools' minds right now, and we're helping them organize that.
Excuse me. Thank you very much for that. I think it's really helpful, at least to me.
Thanks, Ham. Next, we have John Walters, BT Digger. John Walters, BT Digger.
A *6 to unmute, John.
All right, we're going to go to Guy Page.
Governor, there's a lot of bills the legislature is looking at with large dollar signs attached, and I'm wondering if with the pandemic-related deficit, the $430 million deficit, will you be taking a tougher, a second look at some of these bills, like the commercial cannabis has $1 million attached to it because of the deficit?
Well, obviously, Guy, I'm very concerned about the potential deficit, the looming maybe $300 to $500 million deficit in just the regular budget, as well as the $176 million in the education fund as well. So I think, as I've said all along, that we need to put everything together and see what we're facing. And trying to get a sense of the magnitude of the problem, as well as what do we do about it, because we can't obviously tax our way out of this. We have to find ways to live within our means. So again, I think trying to get everything together in one bucket and then contemplate what we do in the future is something that I would be looking at.
Governor, did you say that there was a $500 million deficit? Did I hear that number?
Well, I'm saying we don't know what it is at this point. There's going to be it's been anywhere from $300 to $500 million that I've seen. So we don't know exactly what that is. So the plan is to have a somewhat downsized budget for 3 months, and then we'll have a better sense of what's happening at that point to get through the rest of the year. So we are moving forward with that, but I certainly wouldn't want to pass anything that would further add to the problem that we see, we know is there. We had a decrease in revenues due to the shutdown of businesses due to the COVID-19, so we're going to have to deal with that. It's a reality, and I don't think anyone is thinking that it's business as usual. So we're going to have to contemplate all of that before we pass any significant measures that would add to the burden.
Thank you.
All right, I think Ron Walters mentioned he was back, as long as the star 6 can work.
John, are you there?
Is that you, John?
Are you there, John?
All right, for any of the folks that couldn't get through, or we're having star 6 challenges, go ahead and email me your questions and we'll get those answered. Or we'll be back on Wednesday as well.
Anybody else on the line that didn't get a chance to ask a question? I'd like to hear from all parts of the state.
All right.
Okay, thank you very much.
Email me or we'll be back Wednesday.
Look forward to presenting our economic package on Wednesday. Thanks for tuning in.